In this presentation, we will explore the positions of the muscles and the joints of the pelvic limb. The most dorsal limb joint is in fact the lumbosacral joint, formed by the last lumbar vertebra and the sacrum. It is in fact three joints, here, here, and here. This is the sacrum, this is the ilium, and one floats over the other with just soft tissue in between. And the pelvic limbs have extensive musculature over the pelvis for stride production, specifically for limb extension. The sacroiliac joint forms a fulcrum for the lever made with the trunk, and it must stabilize the substantial forces produced there as they are transmitted to the front end of the horse. The sacroiliac joint binds the pelvis to the sacrum by ligaments which lace those bones together, so this joint is not bioengineered to remain fixed, yet it is a joint which is commonly injured by strain and usually accompanied by simultaneous strain of the suspensory ligaments of the distal lower limb, due to the reciprocal or stay apparatus operating as one long system of levers. As well as securing these two structures, it must dampen the forces between them in all movement planes. So minute shear forces and rotational forces between the sacrum and the ilium as the hind limbs make contact with the ground during gait. It is easy to appreciate how dysfunction of this joint can transfer strain to the sacroiliac and suspensory ligaments if the hind limb movement is not optimally executed and forces absorbed and distributed without the need to hyperflex the fetlock joint, which is the most mobile distal joint of that lever, and therefore subject to substantial stress compared with the relatively stable HOCK and stifle joints. Integrity of this joint is dependent on the optimal functioning of all muscles connected to it. There are 15 muscles in the equine limbs that I'm going to identify, so as I run through them, don't panic about trying to remember the names for now. I would like you to be mindful of muscle function in relation to how they are positioned on the limb so that you can have an educated guess at why they might be limb flexors, extensors, adductors, abductors, or stabilizers in any given moment. And also consider which muscles would operate as reciprocal pairs, but we'll cover that in more detail in the biomechanics module. Your memory retention and recall will become much more fluent when you begin to identify these muscles individually on a live horse. Recall that muscles shown in red are extensors, green the flexors, and yellow having dual roles or some other function that's not flexion or extension. Also recall that these diagrams are representative of visual aids to help you learn muscle origins and insertions to indicate their actions, and as such are not entirely precise as they appear in the body. Muscles with insertions into the femur are gluteus superficialis, commonly known as the superficial gluteal muscle, with its origins on the tuber coxa and gluteal fascia and insertions on the upper femur. It has a dual role of flexing the hip through the cranial muscle fibers and abducting the hip when all fibers are contracted simultaneously. Gluteus medius has origins over a wider area. The lumbar portion of longissimus dorsi, the sacrum and the sacrotuberous ligament, and the iliac wing of the pelvis. The dorsal fibers extend the hip, the ventral fibers abduct. The quadriceps muscle group, with its origins on the ilium and insertion in the tibia via the patellar ligament, flexes the hip joint and extends the stifle joint. Tensor fascia lata is more of a broad aponeurosis of fascia with similar origins and insertions to the quadriceps, except that there is a more lateral insertion onto the tibia. Its function is flexion of the hip joint and some assistance with stifle extension. The adductor muscles pectineus and gracilis originate on the pubic symphysis and insert into the medial femur and a small part of the tibia to adduct the femur and associated hip joint. The dorsal fibers of pectineus assist with hip flexion because of their position high on the femur, close to the hip joint. Muscles with insertion into the tibia are biceps femoris, which originates in the sacrum, sacrotuberous ligament, and tuber ischiae to extend the hip, stifle, and HOCK joints. Semitendinosus with origins similar to biceps femoris, but with attachment to the first two tailbones. Therapists hold on to that useful piece of information for addressing crooked tails. And insertions into the cranial or front part of the tibia, crural fascia, and common calcaneal tendon. It has the same function as biceps femoris when the limb is in contact with the ground in the stance phase of the stride, but when the limb is in flight or off the ground, it flexes and medially rotates the stifle and extends the femur. Semitendinosus and semimembranosus have virtually the same origins, but semimembranosus inserts further down the limb onto the distal medial femur and proximal medial tibia, and extends the hip, and with those medial insertions adducts the limb or draws it closer to the midline of the body. To help you remember which of these two muscles are which, think of the M in semimembranosus as that muscle being more towards the midline or medial in position in relation to the tibia. And both of those muscles, together with biceps femoris, are typically known as the hamstring muscle group. Muscles with insertions at the HOCK joint are peroneus tertius, an important element of the stay or reciprocal apparatus of the hind limb, with origins on the lower lateral femur and 2 insertions, one on the lateral HOCK joint on the sizable tarsal bone and one just below the HOCK on the 3rd metatarsal or cannon bone to flex the HOCK joints this way. Tibialis cranialis has the same origin as peroneus tertius, and again with 2 insertions, almost the same except that the splint bone attachment is on the medial splint bone rather than the lateral to flex the HOCK joint. Gastrocnemius and soleus I will group together. Soleus is deep to gastrocnemius and does not have an origin above the stifle joint. It's about here. Origins are the lateral and medial distal femur to form the calcaneal tendon, inserting into the substantial caudal calcaneal bone of the HOCK joint. Action is stifle flexion and HOCK extension. So flexing the stifle and extending the HOCK. Muscles with insertion below the HOCK joint are extensor digitorum longus, more commonly known as the long digital extensor muscle and tendon, originating on the lateral femur, tracking down the front of the limb and inserting into the cranial pedal bone to extend the hoof. Extensor digitorum lateralis, more commonly known as the lateral digital extensor muscle and tendon, originates on the lateral collateral ligament of the stifle joint and fibula and inserts into the tendon of the extensor digitorum longus to extend the HOCK. Flexor digitorum superficialis, also commonly known as the superficial digital flexor tendon or SDFT, originates on the lateral femur and inserts on the tuber calcaneae or point of HOCK and continues down the back of the leg to bifurcate or branch at the fetlock joint and insert on the front of the long pastern bone. Part of the reciprocal mechanism or stay apparatus, this flexes the digit as its name suggests and extends the HOCK. So flexing the digit, extending the HOCK. Flexor digitorum profundi, more commonly known as the deep digital flexor tendon and muscle. The DDFT has 3 heads originating from the caudal border of the tibia and takes the same path but continues all the way down to cross the fetlock joint and pastern joints to insert in the caudal pedal bone. Note that both of these have suspensory and check or accessory ligaments. Above the HOCK on the superficial digital flexor tendon here and below the HOCK on the deep digital flexor tendon. Let's take a look at the pelvic limb muscles in action in this video. Tensor fascia lata contracting and relaxing here. The gluteal group here. Quadriceps, biceps femoris, and here is semitendinosus, semimembranosus here. See how these muscles work in synchrony with the stretch recoil mechanisms of the fetlock joints. and how the labour-saving reciprocal mechanism instantaneously responds to produce the stride. Here. And this slow motion clip of the structures below the stifle clearly shows how dependent the HOCK and fetlock joints are on optimal muscle balance, or they can become unstable. Here. And some instability there. Also see how the vulnerable suspensory ligaments are to those aberrant rotational forces loaded onto them. This video shows very basic joint testing of the hind limbs.
Only do this if the horse is compliant
Gently
and it is
taking the limb
advisable to
through
wear a
its
hard
range
hat.
of motion.
This can take much practice, and it can be enough to simply observe your
retraction,
horse's reactions to being asked to offer a hind for
protraction,
lifting.
just seeing if the toe can reach the
Extend
ground.
the toe towards the ground,
Abduction.
comparing results with the other side. Note that the limb being lifted may not be the problem, that it could be that the horse is reluctant to have more weight loaded onto the other limb. Also note that a safe surface is used for this.
And next is a method which I use to test muscular restriction higher up the pelvic limbs.
A very vulnerable region for the performance horse. It is therefore useful to assess how your horse reacts to gentle mobilization of the last lumbar joints and potentially the sacroiliac joint. Do not do this if your horse has any existing hind limb joint problems, and again the horse must be on a suitable surface. Lift the hind limb upwards in one movement and observe dorsiflexion of the lumbar on the same side. Movement should be smooth and effortless. Compare one side with the other. In my experience, a unilateral fixation of that joint will result in a very noticeable restriction on one side that the inexperienced handler finds almost impossible to lift against.
And in this film you'll see how much higher the horse is able to flex the left pelvic limb. This is very stuck or restricted here, hardly any flexion at all, and even less here on the left. Do not do this on a horse with hind limb gait abnormalities or unsoundness, because you could exacerbate any lameness issues. And the musculature supporting the lumbosacral joint could be reactive to touch in that region, indicating some strain or injury, but I'll be demonstrating palpation for that in a future presentation. And be aware that the horse could just be reluctant to load one limb more than the other by being reluctant to lift one hind, because to do so loads the other. So the problem hind could be the ground contacting hind limb and not the lifted limb. A simple method for evaluating the horse's preference for loading individual limbs, possibly indicating some muscle weakness, is demonstrated in this video, and consistent patterns observed in a number of trials can give an overall picture of how the horse prefers to organise its posture, and if one or more limbs is not being fully loaded against a particular ground surface. So just simply watch how the hind limbs load. Here's a pattern. Here, possibly this right hind is protracted more in stance, in halt, there.
If you are having any body work or therapy done on your horse, this can be a very simple test to see how much change has been achieved in the posture.
Here, there's a definite
And if your horse
pattern between
reverts,
these
you may
two
find that
limbs.
this is a sign to have your horse checked again.
And the rider. Tensor fascia lata crosses the hip joint and the knee joints for flexion. Quadriceps also crossing the hip and knee joints and also for flexion. Adductors on the inner side of the thigh, same for the horse. Tibialis cranialis on the front and lateral lower leg to flex the ankle joint and the foot, and that's the heels down muscle because it draws the foot up. On the back of the thigh, the gluteal group fusing with tensor fascia lata to abduct the leg, together with biceps femoris and semitendinosus. I've not shown semimembranosus because it's more medial and under the thigh in this picture. Then gastrocnemius and soleus, which is deep to gastrocnemius. And this muscle flexes the knee and extends the ankle. The true heels down muscles, because without relaxation of these muscles, ankle flexion will be restricted. And this concludes the Kinetic Anatomy module of the course, and the next module will cover aspects of equitation biomechanics before we move on to elements of muscle conditioning relevant to equitation.